Welcome to Resiliency Within. I'm your host, Elaine Miller-Karras. For our listeners, I want to let you know that we're on Facebook Live at Resiliency Within. If you'd like to also see myself and Chris Underhill, who is my guest today, I want to talk a little bit about Chris, and we're going to be talking about hope. And Chris works as a mentor and as a social entrepreneur in the field of quality of life and mental health in the community. I first met Chris in Oxford, England, at the Skoll World Forum, and I was struck by his depth of understanding of the suffering of individuals with mental health challenges. He also shares, he's going to share an abundance of hope and how to bring innovations to meet the challenges of those who suffer in developing countries. Chris Underhill draws on his lived experience as a child and his many years hands-on in the field to discuss resiliency and trauma in very poor communities in developing countries and at home. There's an important, inspiring parallel between Chris's early struggles as a child, his own growth, and the growth of his mission in the support of many traumatized people around the world. Chris Underhill will share his humble journey and his wisdom today. And I want to say a few things about the number of enterprises, social enterprises that he started. So I'm going to say their names, but we're going to ask him to tell us a little bit more about what they are. But there's Thrive, which was an organization working in gardening, disability, and community. ADD International, working in the developing world with disabled people, creating systems of representation, advocacy, and policy development. He's also built several organizations in the field of global mental health, Basic Needs, which promotes the model for mental health and development created by Chris in 2000. And there also are a number of basic needs organizations in Ghana, Kenya, and Vietnam, which continue his very important message. And Chris runs his own mentoring practice called Mentor Services. He's the co-founder of a new organization benefiting social entrepreneurs. I love the name, the Elders Council for Social Entrepreneurs. He's a Skoll Foundation awardee. A little bit more, Chris, you've done so much in social entrepreneurship, an awardee in social entrepreneurship of the Schwab Foundation and a senior fellow of the Ashoka, and has been honored. This is a very important one. I didn't know what MBE meant, and I had to look it up. A member of the Order of the British Empire by Her Royal Highness the Queen for his work on disability. Oh my, Chris, that is quite a resume. So you're definitely the first MBE we've had on the show. So welcome, Chris.
Thank you. And thank you for that very fulsome description.
Well, you have a very wholesome and full life. So, as we get started, I always like to ask my guests, you've just listened to a lot about yourself. Is there anything on your mind right now as we're getting started that you want to share with our listeners?
Well, yes, there are a couple of things that are on my mind. First of all, I'm delighted to be here, of course, and looking forward to talking with you and having quite an opportunity to talk with you, because you're not so unfamous yourself.
Oh my goodness. Well, thank you for that. I've done a few things myself.
You definitely have,
yes.
Especially in the field of resilience and trauma.
Yes.
We know that. And so it's lovely to be with you. And because you're a busy woman, to get, quite a long time with you is great. So that's
well, and we have had
right there.
And we've had discussions before this one, so I never find that there's a lack of words in between us. We can probably be talking for hours, Chris. So
that's
thank you.
That's right.
Thank you.
And on a more serious note, I'm obviously aware that a very large number of people have been feeling lonely and have been feeling unwell. They've had low resilience, low mood during this COVID period. And so, I'm very much aware of that. And obviously at some point during our conversation, I think it would be good to talk it through a bit and just sort of reach an understanding of what we understand by that.
Yes.
But it's very important, I think, as one of the, significant pieces of our modern day.
Well, and I think we're all getting a bit weary of the impact that COVID-19 has had on our lives. And also, I think that, the windstorms of life keep happening to us as they would anyway. And I think those forces coupled together have brought many of us to some hard times.
Yes, absolutely. I like the windstorms of life. That's a great phrase, isn't it, Elaine? But
yes.
It's true.
Yes.
It's true. And And I think it's going to be what you might call the long tail of COVID, because, we are likely, I think, as societies, we're likely to be able to get on top of the virus itself.
Yes.
That's, I think, without question. But the depression and anxiety that people have been feeling in very large numbers, uh, both amongst elderly people as well as young people, is definitely the long tail, I think, and therefore it requires us to be attentive not to COVID as a virus, but to the after effects of COVID.
Yes, I think you're absolutely right. And I know some of the things that, in fact, you shared something with me that we hadn't talked about before the show,
Right.
which is Catalyst 3030. Is it 2030?
2030,
3030 would be quite the thing, but 2030,
Yeah.
I think, is a little bit
Yeah.
closer. So
Yeah.
can you just say a few words about Catalyst 2030? Because I think it
Yeah.
directly is related to what you're talking about here.
Well, Catalyst 2030 was founded by a wonderful woman called Jeru, and she felt it was important to bring social entrepreneurs, of which you and I are examples, together, but not just in the field of mental health or resilience, but in many fields. And so the idea, and the 2030 is the clue here, the idea is that we all pull together, we lean in and pull together so as to ensure that social entrepreneurs have made the best possible contribution to the development of and to the achievement of the Sustainable Development Goals, the UN Sustainable Development Goals, the SDGs as they're called. And I've been privileged by Catalyst 2030 to start chairing the mental health working group of that larger organization. And we're beginning to put our plans together now as a working group. Catalyst 2030 has been going for some time, but we're beginning to put our own plans together as a working group. And we're very keen, to be aware of and to be cognizant of the kind of things that we've just begun to talk about. And certainly to be very aware of the issue of trauma and resilience.
Yeah. And, as we're talking about this too, I feel it's really important that we also think outside the box. I've been writing the second edition of my book, and knowing that we have traditional mental health that really were designed for emancipated individuals to go see a therapist, which of course, those of us that are fortunate to have mental health professionals in our communities, I greatly believe in mental health professionals and the different treatments that they bring forward. I'm one myself, but I don't think it's enough. And I think that we definitely have to broaden our scope about how we bring in different kinds of interventions and strategies that increase the mental health of our global community. So I'm so excited that you're heading this up, knowing your global lens, because I think that wide perspective that you have I know will lead that group into exploring a lot of different possibilities.
Well,
But,
I hope so.
yes,
I hope so. We've got some great people on it, and they have their own fantastic abilities and leadership. So I think together we'll definitely make something out of it.
And so, Chris, it's really important that I think our listeners know a little bit about you. Many of them are listening to your fabulous British accent. That's something that many people that are listening are from America. We always sound, so uncouth by comparison. But in any event, in terms of knowing a little bit about you and about your lived experience and what may have been some of the ingredients of your life that have really been that led you to your journey of working in global mental health as you have.
Sure. Yeah. Well, thank you for that. My parents were fascinating. My mum and father and stepmother. My father and mother, when they met in Australia, they were Australians, and they came to England just after the war finished. They were very young, and they came to England just after the war, and they started to travel quite widely. He was a painter, and she was a writer, and so life started pretty well. They then divorced when I was 5, and that was probably one of the sort of early shocks that I sustained as a child. I remember it a little bit, but you know what happens with memory when
Yes.
when you don't want to when you want to blot something out, to be blunt,
Yes.
then you can't remember things as well as you should, you know. Anyway, a little while later, uh, I was living with my mum and by then Malcolm, my stepfather, in Corsica. So this now we're sort of, we find me at about the age of 12, 13, around there. And it was decided by the parental group that I travel back to London to go to school. And up to that point, I've been homeschooled basically. And so I traveled back and I stayed with my father and his wife, my stepmother. And it was there that I was basically ill-treated.
Yes.
And it was not physical chastisement or something of that nature. It was essentially that quite often I was not fed.
So they
Or
neglected the care of you.
yes, they
Yes.
neglected the care of me, and you know the sort of thing that a kid would expect, like being prepared for school and you know all that stuff. All of that went by the board, so I had to do it all myself. And since I hadn't even lived in the country for very long, it wasn't like I was used to it. So that went on for a while. I found myself more and more ending up at one couple's house who were uh, who were friends of my father and had befriended me. They were very concerned, and their son was about my age. He's probably my oldest friend still,
Oh,
and so they were very concerned, and I would end up there and sort of sleep the night, having walked through the dark streets to get to them. And so this wasn't obviously going to end well, you know.
no. I mean, you were so at risk too by others
Yeah,
seeing a young boy
yeah, yeah,
walking to the streets.
that's right. So eventually I had what, you know, now I understand to be a mental health crisis. You know,
Yeah.
in those days it transformed itself as a tummy ache. And a very, you know, children have that kind of
Of
ability to
course,
transform their pain, you know.
of course, when we talk the somatic manifestations
Exactly,
of the traumas they're having, and so
exactly.
that happened to you.
Yes. And so the ambulance was called. Everybody said, oh, he's got an acute appendicitis. So I was rushed to hospital. Now, in those days, the ambulance, because, you know, I was a kid who still observed things, right?
Yes, of
Uh,
course.
so, so I could hear that the ambulance, it was a bell ringing. So this will give you a sort of sense of what period we're talking about. It wasn't a
Yes.
siren, it was a bell. Um, Admittedly an electric bell, but it was a bell.
Yes.
And so we rushed to hospital, and thank goodness the surgeon on duty, who had been ready to whiz me into the theatre, he palpated and found that he didn't
No.
feel that I had appendicitis.
No.
And so he took it on his own risk, you know, in case it was, but he took it on his own risk. And so began a journey which I hadn't anticipated, no one had, which was that the hospital then kept me in. They then, as far as I can judge, and these things are a bit misty, Elaine, but as far as I can
Yeah.
judge, they didn't release me because they didn't want to release me back to where I had been living.
Was there
Uh,
anything like child protective services there at those
as,
in those
uh, uh,
days?
yes, there was such a thing as being made a ward of court, for example.
Uh-huh.
Same sort of, just a different language for the same thing, essentially.
Yeah.
And I had a lot of people come and have, you know, question me, have discussions, and so on and so forth. But one of the things that I always remember about that period was the kindness of strangers, you know.
Yeah. Yeah.
And I was I think in retrospect, I must have been quite distraught.
Yes.
Um, and a
And alone,
nurse,
and very alone.
yep,
You taken from
absolutely.
your mom and Corsica and coming to a
Yeah,
strange land.
absolutely. Absolutely. So a mum was, a nurse was deputed to keep an eye on me. And she
Yes.
would come in and she took one look at me when she first came and said, right, well, we've got to get your hair cut. We've got to get you washed. I suspect deloused. Um, and so there was quite a lot of immediate work to do. And then she would come in regularly every day. And she did something which I think was really admirable. She would put me to bed,
Oh,
you know, at lights out, you know, and um, and she would read a story to me. Now, you know,
oh
some
my.
people when they're 13, you know, you might think that was a bit old,
No.
But for me, it was absolutely comforting, to have that story being read to me.
You
And
were
then
being
she would,
cared for. You were being cared
yes,
for in just a very sweet way.
yeah. Then she would lean over, kiss me on the cheek, tuck me in, and I would sleep. I slept like a bell after that. Um, and I still remember she must have had, some moisturizer or something like that on her face.
Yes.
So whenever I smell that smell, it
Mm.
immediately takes me back to her.
That's
Uh,
those implicit memory capsules we talk about, right?
there you
That they
go.
can be connected to our well-being and
Yeah,
memories like that.
yeah,
Also, sadly, the trauma as well. But
yeah, yeah,
it's important to also remember what else is true when those kinds of
yeah.
things happen. Yeah, of
So this is beyond. This is before the days of email and mobile phones and stuff. So,
course.
so Malcolm and Shirley, Malcolm my stepdad, and Shirley my mum, they eventually got to hear that my letters back, where I had said everything was fine. Uh, you know, this is classic stuff, isn't it?
Yes.
They eventually got a letter from that couple where I had been staying, and going to see security. And they said, "Look, Chris is in the hospital. This is what's happened." And he came over and he assessed the situation. Obviously, he felt very cross about it, and he took me back to Corsica, basically. And so then began a period of what, in professional language, we'd call rehabilitation.
Yeah, and healing,
Um,
I would suspect.
absolutely,
Yeah.
absolutely. And it took me about a year to kind of get back to where I'd started from, if I can put it that way.
Well, and so, because I imagine there's some malnourishment as well
Hmm.
physically if you
Yeah,
weren't if they
yeah,
weren't feeding you, as well as the psychological
yeah,
toll.
yeah. The hospital had made up for some of that, but certainly the psychological tone. Yeah.
Yeah. And
Mm-hmm.
could I ask you a question? Were you
Mm-hmm.
angry at your parents, your mom and Malcolm, for sending you there, or was that part of the journey or not?
It's funny. I didn't feel particularly angry. Do you know what, Elaine? I don't think I felt actually angry
Yeah.
with anybody.
Huh.
In terms of the four main principles. Um, and I don't quite know how to explain that to you. But I didn't. I felt insecure, of course.
Yeah.
Um, and and so it took me a while. So I guess we would say it took me a while to trust again.
To trust. So it was more of a mistrust
Yes,
of them rather than an anger. Yeah.
yeah. Much later on, in my late teens, early 20s, I did have a period of being angry, but that could also be, construed as being teenagers, late teenage
Yeah, it
stuff.
could, or maybe it
Yeah.
was or could also be a mixture. Who knows?
Who knows?
You know, or part of
Yeah.
you knows, right?
Yes. Yes.
Yeah,
Yes.
but even with that difficult time you went through, I mean, and thank you so much for sharing the story of the nurse and also the couple,
Mm-hmm.
and your best friend who's still one of your dearest friends.
Mm-hmm.
So with all that, there were people that you had these little angels.
Oh gosh, yes, yes, yes.
Yes,
It's not all one way by any means.
yeah,
Um, absolutely.
and
Yeah.
so from that, here you have. I'm going to kind of lead you to another question that's kind of
Mm-hmm.
connected. Is that some people create one organization and make that their life work.
Mm-hmm.
You seem to have created a number of different organizations over your life that
Mm-hmm.
certainly might help a child like you, right? If someone, in some country was struggling. So why do you think you've tackled your passion, um, your in hope and resiliency in this way,
Yeah.
coming from the story that you've shared with us? And thank you so much, Chris, for sharing that heartfelt
No,
journey.
it's good to share it with you. Thank you.
Thank
Um, I think one thing I have to say is that I was able, through a set of really good fortune, to eventually go to a school which was very attractive and a lovely school for me to be able to be in. So it was a very different kind of school. It was co-ed, and that's where I met my wife, or at least my wife to be. Uh, and so the healing journey began quite early on, and she and I bonded when we were 16, and we married when we were 21, 22, and we've been married ever since. So that's what, 52 years or something
Oh
like
my
that.
goodness, that is
Yeah.
amazing.
So that is part of the story, and I wouldn't want Giselle, my wife, to not, get credit for that, because otherwise I think that would be
Well, I mean, she certainly has been a life partner. I mean,
mm,
since
literally.
childhood.
Yeah,
So
yeah, yeah.
Giselle, thank you,
Giselle.
Giselle, for being together with Chris.
Exactly. Thank you.
Yes.
Yes, yes, yes. So now to your question. Um, for me, it was, and this may sound banal or a little strange, but I saw opportunity, a bit like a business person might see an opportunity, and I saw what you and I would call a social opportunity. Uh, and I realized that in Thrive, for example, which was the first organization, which I started in, when dinosaurs still ruled the world in 1978, um, I, I started this organization, and it's all about uh, nature. It's all about gardening, particularly horticulture, and how all of that uh, benefits and can be worked with by disabled people, people with dementia, people who are elderly. In other words, all the different needy groups who might really enjoy gardening. And of course, being the UK and raining a lot in the UK, as you know, and having terrible weather.
You are an island, I believe.
Yes,
Yes,
exactly.
yes, you are. Yes.
Yeah, but gardening is terribly popular, which is ridiculous when you think about it. I mean, there should be some indoor pursuit, right, which is popular, but no, not at all. We all love going out and gardening. And my wife, by the way, is the keen gardener in our family. So I realized that there was this incredible relationship between nature, between gardening, horticulture, some forms of land use, and people, and that there were many restorative, even curative, but certainly restorative elements to that. And so I was really fortunate in having a wonderful father-in-law who was very, very supportive of me. In many ways, a father figure,
Yes.
which again I think is part of that healing journey, Elaine.
And you met him when you were so young.
Yes,
Yes.
yes, exactly. In fact, I almost missed him because I was on a train going there to stay for the first time at their farm, and I fell asleep.
Well, I'm glad you didn't miss him. So you must have woken up at some
I
point.
woke, I woke,
Yes.
I like, I woke up and snatched my suitcase off the rack and my coat, and then bundled out of the train just as it was about to leave again. And there he was. So I sort of fell at his feet, basically, and that amused him hugely. And then from then on, we got on like a house on fire. So, and he really helped me to get this because he was a wonderful botanist, horticulturalist, and he helped me to sort of frame the whole thing. At that time, I had no idea what a business plan was or anything of that type, So he helped me to frame it, and he got the introductions for me, which meant that I could go and talk to the money people. And so I, I went and presented, as we would now say, but I mean, in those days, I just talked about my idea very passionately,
I could just see you as a young man, very passionately talking. I bet you had long hair too. I don't know if you did, but yes,
I
of
did
course you did.
long
Yes,
hair. Yes,
yes,
yes, long
yes,
hair,
yes.
but rather than now, where I have virtually no hair. Yes, yes, and the gentleman in question, a Quaker from one of those big foundations run by the Quakers, he said, "Could you write that down for me? What you've just talked about." And I said, I was being ridiculously naive. I said, "Really? But I've just told you." And so he said, "No, it would be really helpful."
If you actually made a written business plan, yes, that would be good. I love that you were thinking about scalability, with your first kind of venture.
I
So
know.
that's
It was
amazing.
really interesting.
And so then what happened with the
Well,
organization?
we put the money, we put a letter in, as he called it, and we put a budget together with the help of Theo, my father-in-law, and everything was great. And then a little postcard arrived. This is still before email. And a little postcard arrived to say that they had received the documentation and we would hear in due course. And then time went on, we kind of almost forgot about it, except we didn't really. And we'd asked for money for 3 years to operate the basic charity for 3 years. And then finally a letter arrived, and it was just a letter, just opened it like a normal letter, and inside was a check. It said, the trustees had great pleasure in reading this and so on, and they're happy to say that they're going to fund it. But there's only one problem. My heart fell at that line, only one problem, and that is that we hadn't asked for enough.
Oh no.
Bless them.
Yes.
So they said, we would like you to ask for another, whatever it was, say 3,000 or 4,000 in those days. 3,000 or 4,000
that was a lot of
meant
money.
something.
That's
Yes,
a lot of money. Yes.
And so we immediately wrote back and said, we're asking you for the 3,000 or 4,000 extra.
I love that they asked you to ask them for more money.
Yes,
I mean,
yes.
when does that happen, right?
I know.
Especially when you're first starting out.
I know. And I was so untried when you think about it.
Well,
and
your first success.
Exactly.
Many to come.
And the check was for 2,000, and it was to get us started. And then the rest was all sent at once. Can you imagine? For 3 years, all sent in one bundle.
Oh my
so
word! I mean, I would have seen that check. I think I might have passed out a bit. Oh my goodness! Here I have the money for my idea.
We stood there in the kitchen, Giselle and I. We stood there. We'd opened the letter. We stood there, and we just were completely gobsmacked. We were dumbfounded. We were unable to talk for a few minutes. It was really interesting.
Chris, that is a wonderful story. I see that. Oh my goodness, I'm going to have you back on the show again. We've only gotten through one of my questions, and it's time for our break. So,
oh my God!
I know there's going to be a part 2, Chris Underhill. I just want you all to know. But in any event, we're going to take a short break. And then listeners, we are going to come back, and Chris Underhill is going to continue to tell us about some of the amazing enterprises that he started, and also more of his journey. So we'll be back in just a couple minutes, and you'll hear a little bit from our sponsor, and we'll be back shortly. Welcome back. I'm here with Chris Underhill, and we've been having a lively discussion about the endeavors that he's been involved with, the charities that he's organized. We were talking about his first charity, and we would love to hear, well, so is it still going? You started it when you were 29 years old. That was a few years ago.
Yes, it was.
A few years ago, Chris.
Yeah. How delicately you put that.
Yes, that's right. So
you must be a professional.
I must be. I think did you just have like a 40-year anniversary of this organization? How did I know that too?
Yes, exactly. And I was invited to go back and help cut the cake alongside a member of the royal family, which was great, Princess Alice. And so it's lovely when you've started something like that and it's going super well, and much larger than when I started it. And you go back and you kind of see the whole idea laid out but at a different stage,
Right, and the fruits of your initial labor, and how it's I guess the tree, because the tree is continuing to bear fruit. I have a question to ask you about horticulture and mental health. It does seem to me that when people sometimes work with the ground and grow things and see things sprout from seeds, that there's something happens inside of us as kind of part of the greater whole of the earth. I guess I've had that experience. Is that part of it, do you think, in the work that you did with folks that came and worked on the land?
Sure. I mean, you can look at it in many different ways. You've got the mechanical aspect. So if somebody has had an orthopedic operation, or maybe a knee operation or something like that, and they've got to be able to move as part of the rehabilitation process, being able to prick out plants and work, in an organized, systematic way takes you out of the pain that you're experiencing. And it literally means you've got to focus and concentrate on these tiny seedlings, otherwise you'll destroy them, Yes. So there are these kind of mechanical aspects which are very important. There is the spiritual dimension too, I think. A lot of people really relate and commune to nature and to, growing plants of all kinds, both floral as well as fruit and veg, and I think that's extremely important. And to some extent, nature is forgiving. I mean, if you can, if you plant something and it's not quite right, it may well still sprout,
Yes.
um, and so, I think all of that is important. I remember, Elaine, very early on in the start of that organization, we were working with people with Down syndrome. And at that time, it sounds archaic now, but at that time, a lot of them were still in hospital. So they were long-term hospital. And so with a wonderful and compassionate gentleman, psychiatrist, working in the south of England, he invited me to set up a horticultural therapy program. And so we did. And one of the young men who was in it tapped me on the shoulder one day and he said, "Chris, I want you to come with me. I've got something to show you." So we went into the ward, rather dingy ward, nothing cruel about it, but just not very imaginative, and a bit sort of staid. And there were beds lined up one after the other, a bit like any ward. And there was a little tiny cupboard, a bed cupboard, next. And that was his only private space, basically. Now, there was his dad and mum sitting on the bed, waiting for this apparition to come, i.e. me.
So he wanted you to meet his parents.
Yes, he wanted me to meet his dad and mum. So we met, and there was nowhere to sit, so we all sat on the bed. And then he said, "Now, Dad and Mum, or Mummy and Daddy, whatever he called them," he said, "Now I've got something for you." And so he opened the cupboard door, his little cupboard door, and pulled out a huge cabbage.
Oh my gosh.
Like this, a huge cabbage. I mean, really big, very well grown. And presented to them. As you can imagine, they burst into tears. I burst into tears.
He was so proud of something that he had grown. Oh my gosh. Well,
yeah.
I just want our listeners to know, if you could see Chris's face, he had a smile from ear to ear when he talked about the cabbage.
Yeah.
But isn't that a moment? I mean, that to me, that's the moment, this program is about hope.
Yeah.
That's those moments of hope, isn't it?
Yeah.
That here, a young man who was born with, definitely a challenge, and that you could bring something into his life that would make him feel, so accomplished, empower him, right? Empowerment, I think, is, and I guess, kind of a segue to that amazing story is that you have worked with community mental health. And I know there's the Action on Disability and Development, which you began in 1985, and that was even before the United Nations Convention on the Rights of Persons with Disabilities. So how did that come to be? And what was that next part of your journey?
Sure. Well, I had long, with ADD, yes, I'd long taken an interest in the developing world, and had started to travel in countries like Zimbabwe, and in fact had been invited to join a commission looking at the best way in which people coming in from the wounded ex-combatants coming in from the front line during that civil war that Zimbabwe had, as it went from Rhodesia to Zimbabwe, looking at the best way in which they could rehabilitate. So that was, and in the context, I then met a whole bunch of disabled people who were really strong, very well organized, quite militant. And we sat in a room together one day, and they said, what we need is help in organizing our own organizations of disabled people. And what we need is training, we need funding. So in the end, it took a little while to kind of crystallize, but in the end, I realized that what they needed was a kind of development agency, which would have their back and work not for them, actually, because the whole point of disability liberation is that people should represent themselves.
Yeah, so working with them, alongside them.
Yes, in compatriotship, if you like.
Yes.
In comradeship. And so I went back to the UK eventually and started to put this together. So then eventually I had to say to my trustees at Thrive, look, I want to go and start this new thing. And they were a bit fed up because we'd got to quite a nice stage at Thrive, 7 years in. And I said, no, I really want to go. And so they, so we organized it all well, and we had a great successor come in, and that was fine. And then, as a gift, they gave me a bike.
To
said,
ride to your next journey.
Yes,
But
yeah.
Chris, at this time you knew how to not only talk about a plan, but to write it down for your next
Yes,
funder. So you already
you're
had that
right.
experience. You were ready to
Yeah,
go for
I
the
was
ABE.
exactly,
Yes. Yes.
exactly. And we did have a lovely angel at that time, a gentleman who unfortunately now has passed, but a gentleman called Lord Joffe, Joffe, Joel Joffe, and he had been the advocate for Nelson Mandela during the Rivonia trials, before he went off to Robben Island. And so when Joel realized that they had lost the case, but in many ways morally won it, he and his wife Vanetta came to the UK, and then eventually started a business, and eventually were in a position to back these madcap ideas, one of which was mine. And he was so sweet the way he helped me to make that business plan. By the way, I remember passing him the first business plan, and it came back with red ink all over it.
Saying, okay, we need this, we need this. No, we need to improve this. So you had some good angels and good instructors.
Yes, but
instructing angels. Yes.
He and Vanetta and his company were really fantastic at putting their mouth, where their money was, or their money where their mouth was, I should say. And in that case, we were able to set up the organization in good stead and get going. And it's still going today. And it's still a wonderful organization, still working in the service of disabled people.
So
right
I'm just wondering,
countries.
Did you get a helicopter when you left this organization if they gave you a bike after the first one? I imagine they didn't want you to go either.
No, but they gave me a surprise party, which gave me a hell of a shock. I was absolutely, what's that? It was one of those ones where, I haven't got much hair. I used to have a lot of hair, like you pointed out earlier.
Yes,
and I think I probably lost it at that moment. It was, it was great to be able to leave them in good stead. And they're still going today, as I say.
Well, I mean, and so, we're not going to be able to talk about all the organizations that you've inspired and created, but I do want to talk a little bit about your perceptions about what are the ingredients that contribute to global mental health. Here they've asked you to chair the Catalyst committee on this, and I imagine you must have a lot of ideas, and I think our listeners would be really interested in some of the concrete ideas that you have. Would you share some of those with us?
Yeah, but pleasure. I mean, my interest in this really stems from community mental health. In other words, how can people with a mental health concern or issue live in the community? In many cases, they're not going to get access to a licensed or trained professional in the normal sense of the word.
Exactly.
So how are they going to get succor? How can they be supported? And so I really began to think about this, particularly in the context of the developing world. I started in India, in fact, and then moved out to Ghana, and then to Sri Lanka, and then to 15 other countries over time. And when I left it, we were reaching just over 800,000 people. So it was, a big affair by the time I left it.
Now, is this basic needs?
Yes, basic needs. Yes,
yes. So that's the name.
Yeah, and I was very concerned that we reach as many people as possible. So at a certain point, the organization, although after I left it, merged with a wonderful organization called CBM in the UK. But some of the basic needs offices have remained basic needs around the world. So we've got, as you said earlier, basic needs in Vietnam, Laos. There's also one in China, one in India, and one in Ghana, and one in Kenya. So we've got, and one in the US, by the way. So with a marvelous committee of people running it in the US. So we have a number of basic needs organizations operating, and CBM also, and they're all working on this model that I developed. So for me, the model for mental health and development was essentially a way of galvanizing the community to understand what mental health issues were, that they were not something to be frightened of, that they were not something that was a curse from above, that these were issues that were very understandable and often very treatable, and very often very understandable, particularly if the family had also been given training and understanding in the context of mental health. And so we were able to set up shop and work in countries which had, a very sparse number of trained individuals, but we were able to put into place the resources necessary so that people could, first of all, be identified as having a problem, then the families be supported and consoled if it was an issue that they were really anxious about, and eventually working together as a community effort, seek treatment where it was appropriate, and certainly work with people so that they could start to make a buck. Because, one of the huge problems about mental health is that you tend to get excluded. And so exclusion becomes one of those, it's often referred to as stigma, but you become excluded from the society which you love and which you feel part of. And one of the ways to come back into the society is if you can be trained or supported in a livelihood of some kind.
Yeah, so they can be contributing members of their society. So
absolutely.
So
absolutely.
The persons that provided the education so that people could understand, what mental health challenges were, and who would bring the information to the families. Now, were these community workers that you trained? So what I call natural leaders of the community to come in and
exactly.
to reach out?
Yes. So some of those natural leaders are volunteers.
Yes.
Some of them are paid. Some halfway, a little stipend of some kind or another. We also had a scheme at one point, talking of bicycles, whereby all of those people got a bicycle as part of their stipend so that they could cover more terrain. And that proved very popular. It also proved very popular to sponsor a bicycle. Yes, we basically designed a program of activity which included and incorporated the consultation of individuals with mental health problems and their families. And then it included an attempt to try and access treatment where necessary. And it included what I told you about earlier, the whole income generation stuff.
Yes.
And it also supported people coming together to create their own self-help groups. So you had self-help groups of people with a mental health problem.
And so they were coming together. Yeah, coming. Yes. And I think what's really important for our listeners, that if you haven't traveled, in terms of our global community, and, I could say this even in the United States, in different parts of our country and rural areas, that there aren't really enough mental health providers to provide the kind of help that is needed. And I think especially, we first started out today talking about the pandemic. I mean, so many people, children, teens, adults, seniors are impacted by the pandemic. And if we only leave it in the hands and say, oh, what is the licensed mental health response?
Yes.
It's not going to have the impact that we need as a global community. And I think the ideas like basic needs is, how do we mobilize those natural leaders of communities?
Yes.
And as again, I think even from when you talked about ADD, about being with people, not doing it for them, is that you were collaborators and partners. And I think from the first time you and I met, Chris, we had the same ideas about how we access communities to really try to help with the challenges of the mental health challenges that we're experiencing right now.
I mean, I think we of course all appreciate the professional person. Of course we do.
Of course.
Yes. And so it's not about ignoring their skills. It's actually about optimizing those skills.
Maximizing, exactly. Because you have the best systems work with a triage system, so that maybe people with more profound, the chronic and persistent mental health conditions like schizophrenia, for example, that they get the kind of help they need. Because also, sadly, the kinds of medications that stabilize mood, for example, are not as readily available in many of the places you and I have worked.
Yeah.
And so there has to be other systems of support, or if there's just a small pocket of resources, how can you maximize those mental health resources? So we would never want anyone who's listening who's a mental health professional to think that we're all important in the chain of command, so to speak, and how we support community.
And I think culture is really important here,
Yes.
I think it's really important to understand how people regard someone with a serious mental illness in a different country. And if you want to offer training, about a particular illness, for example, then it has to be done with cultural sensitivity,
Yes.
And that's why I've always used trainers who are from the local area.
Yeah.
I've very rarely used trainers who are from abroad, as it were. From abroad to that place. It's very important, I think, for people who understand the culture to be able to teach within the culture and help to be able to make progress in that way.
And I think, that cultural lens and even the wording that we use may be very different in the West compared to other countries. We've certainly found the same thing. And also it's more accessible when there's a person who speaks my language, who looks like me, right? Who is delivering a message that is about maybe shifting some of the art perspectives. And certainly with mental health conditions, I mean, this is something that we continually need to work on, because there's still sadly a lot of stigma associated with it. Oh my goodness, Chris, our time is almost up. So I don't want us to leave without us talking about Cities Rise and the Elders Council of Social Entrepreneurs.
Yes.
So can you let us know a little bit about of these two endeavors?
Yes, sure. Yeah, Cities Rise is an organization that I co-founded with Moitri Singha, and it's an organization which works, as the name implies, in the big city, and it's chosen a number of big cities around the world, and its particular emphasis is on youth within that. It's done very, very well indeed, and it's in full gear, motoring along, and I'm delighted that it's so successful. And when it comes to the Elders Council for Social Entrepreneurs, so about 3.5 years ago, 4 years ago, Andrea Coleman, Mel Young, and myself, three musketeers, all of us grey-haired musketeers, we met, and we decided that there was a gap in the market. There you go. That a whole lot of us, I had started my first organization in 78, a whole lot of us, the baby boomers, were coming to an age, those of us who were social entrepreneurs, coming to an age where we were beginning to hand over the reins. Some call it transition, some call it succession, etc. Yes. And so handing over the reins meant, a whole number of things. Some people very sad, some people very disorganized, some people, going on to do something totally different. And so it went on like that. So we felt, let's create an organization that we can be members of. And it's not a fee-paying thing. It's just you can join if you want to. And it's elderscouncil.net. And you can join our webinars, which are now very popular, and where we discuss all of these issues in more detail. And the beautiful thing, Elaine, is that although it was designed for that particular age group, or age profile, a lot of young people join us.
They're finding value from the mentorship from the elders, I imagine.
I guess so. I guess so. So we have a lovely mix now, which is even better.
Well, I definitely need to hop on because I would love to listen at some point. So
You'll
Chris, and we have a couple of minutes left. As we are ending, it's really important that people know how to get in touch with you. They may want to find out how they can be part of some of the projects that you're working on. Can you let us know what is the best way to get in touch with Chris Underhill?
I think probably my email is the simplest. Okay. Would that be all right?
Yes. So what is your email? Just go ahead and say it out loud.
Yeah. So it's chris@chrisunderhill.com.
Well, that's easy. Chris@chrisunderhill.com. Okay. I'm going to repeat that. And so, Chris, are there we have like 2 minutes left. any wisdom, parting words that you want to leave our guests with today?
I think never go into an enterprise such as the sort of ones that we've been talking about without having a sense of humor.
All right. So we did talk about hope. We were talking about this before the show aired, how we both have learned that a sense of humor is just very important.
Absolutely. Because that is that's in a sense the herald of hope, isn't it?
Yes, the herald of hope. Yes.
You see?
A sense of humor. So Chris, I just want to thank you so much for coming on the show today, and we will definitely have you back, later part of the year, and you can give us part 2, and we can hear a little bit more about your wisdom. I'm also very intrigued by the work that you're doing right now about bringing this vision and these ideas from your lived experience to another whole set of folks that are thinking about expanding it out into the future. Right now, we need it more than ever.
Absolutely.
So thank you, Chris. And he stayed up very late. So I think it's like 10 o'clock, right? In England right now. So thank you for staying.
I'm going to have to get my cocoa.
Yes, you're going to have to get your cocoa and go and take a sleep. And for my listeners, thank you so much. Remember what else is true. When we hear about Chris and the struggles he had as a child, and look at how, yes, he leaned into suffering, but then he leaned out into creating hope and resiliency and reaching out to some of the most underserved and oppressed in the world and creating innovation and ideas to really bring vitality and to acknowledge and empower what was already there. So remember what else is true in your life. And if any of you are suffering that you might need some assistance, remember our sponsor, the Trauma Resource Institute.com. You can go and just go into the website and they can refer you to a mental health professional. And also there's many webinars on the community resiliency model that are skills that can help enhance your well-being. So until next time, remember what else is true. Signing off.